So neuropathic pain is essentially pain that is caused by problems with signals from the nerves. The International Association for the Study of Pain defines neuropathic pain as pain that is essentially arising from a lesion or dysfunction within the nervous system. So this is very different from nociceptive pain, that is a pain that arises as a result of some injury or after a burn, for example. The prevalence of neuropathic pain is an average roughly about 3 to 15%, depending on what literature we study. So the symptoms of neuropathic pain can be a number of them, although patients find it quite hard to describe these symptoms. The usual symptoms that patients will present with in a pain clinic setting are they would describe of sharp, shooting, stabbing, burning, lancinating pain. Many a times there are some abnormal sensations that patients will describe of, such as an itching or a pins and needles or a tingling sensation. So it can be quite a number of presentations patients can present with, and unless one has taken a clear, detailed, thorough history, one can miss on these important features. So neuropathic pain can be broadly classified into two types: peripheral neuropathic pain, or which essentially means that neuropathic pain that is coming from problems with the nerves in the peripheries of the extremities. And the other type is a central neuropathic pain, which essentially means problem with the spinal cord or the pain that is arising from as a result of with some sort of imbalance in the nervous system, such as the brain and the spinal cord. The examples of peripheral neuropathic pain can be complex regional pain syndrome, type 1 or type 2. The other example is post-herpetic neuralgia, which is mainly pain that is after a herpes zoster infection. Third one is pain linked to diabetes, which is diabetic neuropathy. And on the other hand, the central neuropathic pain is mainly pain as a result of such as a post-stroke pain or even multiple sclerosis. So neuropathic pain, by definition, means a lesion or a dysfunction within the nervous system itself, whether it's peripheral nervous system or central nervous system. So any sort of injury that's affecting the nerves, any sort of an insult to the human physiological system that results in the nerve not functioning properly, or the signals that are not being transmitted properly, causes neuropathic pain. Although the exact cause of neuropathic pain is not always known. There can be several mechanisms that may be involved both in the brain and in the spinal cord and in the peripheral nerves itself, leading to either an excess release of neurotransmitters or sometimes a lack of them. So chronic neuropathic pain is essentially treated with a multidisciplinary, holistic, multimodal approach. This essentially means that we have, broadly saying, 4 categories of managing anybody's pain problem, which could be either with the use of medicines. The second one is with the use of the pain management approach, which is pain psychology and pain physiotherapy being the third one. And the last one is mainly with adopting interventional techniques such as nerve root blocks or epidurals, if it is required, and especially if the patient has had not much benefit from the other alternate ways of managing chronic neuropathic pain. So there are a number of things that people can do in their everyday lives to manage neuropathic pain. And I would begin with is that they shouldn't ignore any signs, any symptoms that they're experiencing, which they feel is odd and is not expected. So one, for example, here is after surgery, for example, if there would be some pain expected, but if they find that this pain is out of sync or the expected norm for that sort of pain, then they should seek help. That would be first talking to their surgeon first to see that if that kind of pain is expected, but equally not ignoring their signs and symptoms and seeking help from a pain specialist who can then guide them and reassure them and start the right treatment promptly so that the pain doesn't become chronic in the first place itself. There are other self-management strategies that people can adopt, which can help break the cycle of pain, especially when it's become chronic. This would include incorporating strategies of goal setting, pacing themselves, mindfulness, relaxation techniques, distraction measures, sleep hygiene. And all of this is further facilitated when they see a chronic pain physician who can guide them about all these techniques and perhaps refer them to the pain management team if indicated for a better understanding of the ways of managing long-term pain.